Hello and a very warm welcome, viewers. You're watching the brand new edition of To The Point with your host, Kriti Mishra. The world is facing an unprecedented challenge with communities and economies everywhere affected by the growing COVID-19 pandemic. The world is coming together to combat the pandemic, bringing governments, organizations from across industries and sectors and individuals together to help respond to this global outbreak. The World Health Organization is leading and coordinating the global effort, supporting countries to prevent, detect, and respond to the pandemic. In fact, the WHO Foundation, headquartered in Geneva in Switzerland, an independent grant-making foundation, is focused on addressing the most pressing global health challenges of today. A new coronavirus disease solidarity response fund is also being raised from a wide range of donors to support the work of the World Health Organization and partners to help countries respond to the COVID-19 pandemic. And joining us today on the program is the Chief Executive Officer of WHO Foundation, Mr. Anil Soni. He's joining us from Geneva in Switzerland through virtual platform. Sir, welcome to Sansad TV and thank you so much for joining us.
Thank you very much, Kriti, for having me.
Thank you so much, sir. So 2020 must have been a tough time for you with the outbreak of the global coronavirus pandemic. How did you navigate through this uncharted territory?
Well, the beginning of the pandemic was a tough time for every single person in the world and every organization, including the United Nations. But it was the World Health Organization's responsibility to be at the lead, to ensure that they could provide information to help reassure the public, to inform the public and governments how to respond to the pandemic, to begin the research and development that thankfully has led to vaccines today, less than 18 months later. But in those first days, in those first weeks, it was actually the generosity of the public. It was individuals and corporations who committed to the World Health Organization $200 million in 6 weeks. And that early money allowed the WHO to fulfill its leadership role and to make sure that we could respond quickly to the beginnings of the pandemic, understand what was going on, and really develop a strategy that's allowed the world to navigate these uncharted waters since.
All right, sir. Talking about India, of course, we'll talk about WHO Foundation and its activities in just a bit. But before that, India administered record jabs on Monday. How do you assess India's fight against the pandemic?
India's had an incredible challenge. And the fact that we have recently, I understand, seen a decline in cases is a credit to everyone who is doing their part to respond to the pandemic in India. The country is one of the most populous in the world, with some of the most densely populated cities and areas in the world. And because the coronavirus travels through the air between informal contact of individuals, the challenge of containing the virus was always going to be massive. The response to the pandemic in India requires the collaboration of the government, of course, in its leadership role, both at the state and national level, but also international organizations like the WHO, community organizations, and individuals. It cannot be overemphasized that individual action to keep distance, to wear masks, now to get vaccines, is what will ultimately end the pandemic. And in that regard, I'm very proud and moved, despite the incredible difficulties and crisis, that the government, the community organizations, multilateral organizations, and every one of you listening, individuals, has made the progress that you have to now bring the caseload down. And as you said, Kriti, to begin record levels of vaccinations, because that will be the way out of the pandemic.
All right, thank you so much, sir, for that appreciation. But talking about WHO Foundation, we understand that 1 year ago, WHO also created the COVID-19 Solidarity Response Fund. Tell us more about this fund, sir.
The Solidarity Response Fund is what I mentioned earlier. It's a way for individuals to give to the World Health Organization. The WHO, as you know, is a United Nations agency. It was created after World War II, 70 years ago. It's a member state organization. In other words, the governments of the world, including the government of India, sit down and inform the strategy of the WHO and also give it most of its money. In the past, what we've seen prior to the COVID-19 pandemic was that the WHO needs more resources. It's actually one of the very few agencies that doesn't receive resources from corporations or individuals. The Solidarity Response Fund, exactly as you just heard it, the words explain themselves, is a fund to allow for solidarity across sectors, both the public sector, but also the private sector. So it was an opportunity for individuals and companies to provide funding to the WHO to allow it to develop a strategic preparedness and response plan, and to allow it to respond immediately to the pandemic and continue to respond to the pandemic. As you know well, Kriti, the needs are no less urgent today than they ever have been. Now we are talking about the need for medical oxygen as opposed to PPE, which is what we were talking about in March of 2020. So the needs to procure these resources, the needs to develop mobile hospitals, to put boots on the ground, to support national governments, community organizations, to support the R&D, that's what the Solidarity Response Fund allows. And that flexible funding to the WHO has been critically important.
So, Mr. Soni, how has been the response from individuals, corporations, and other organizations towards this fund?
Well, individuals and corporations have been the ones who have contributed. So there's a number of corporations who each gave $10 million, $250 million has been raised already. That also includes contributions from 600,000 individuals. So it's been a great collective enterprise to raise these resources.
All right, sir, we don't know how the virus is going to behave. How will you raise and disperse funds for all WHO global health priorities in full alignment with the WHO member state adopted general program of work?
Well, I'm really glad, Preeti, that you're referring to that broader general program of work, because as you know well, COVID is the immediate crisis. We must respond effectively, but it's not the only condition that's affecting health around the world. There are still tens of millions of preventable deaths each year due to causes such as pneumonia or malaria that we know how to prevent or treat, whether with vaccines or even with access to clean water or basic mechanisms like swaddling a baby after it's born or hand washing. All of that needs to be the focus of the WHO and its member states to ensure that everyone has the fulfilled right to health, because health is what allows anything else to happen. In terms of how the WHO and the foundation to support it is raising resources, when it comes to COVID, the WHO has a strategic preparedness and response plan for this year, 2021. Unfortunately, I think it's a sure thing that it's going to need to have one for 2022 to come out of the pandemic. That is the strategic plan that ensures clarity of what the WHO is doing at the global, regional, and national level. And that continues to be what we seek funding for, both from the private sector, corporations, individuals through the Solidarity Response Fund, but also importantly, critically, fundamentally, through the member states themselves who need to ensure adequate funding for the WHO and the other international organizations who are leading the response to COVID-19. Beyond COVID-19, you already referred to the global program of work. That is the strategy of the WHO. And what it's seeking to do is incredibly ambitious. It's seeking over the coming years to make sure that an additional billion people are protected from health emergencies like COVID-19, that an additional billion people have access to universal health care, and that an additional billion people are benefiting from good health and well-being. Those are the triple billion goals that the WHO is pursuing. And it's incredibly ambitious, and it's what they are going to the member states to ensure that they have the funding to pursue right along with national governments, because it's ensuring that those goals are met, that we can mitigate the effects of diseases and emergencies like COVID-19 in the future.
Absolutely, point well taken, sir. But I'm also reminded of a very important statement that you made. And you said that if corporations get preferential access or any access to decision-making as a soft quid pro quo, it's disastrous for the organization, not only because it could influence what WHO is recommending, but more importantly, it can be seen to influence it. Will there be parameters in terms of funding that you'll be raising from the private sector in the post-COVID era or even during COVID?
Absolutely, absolutely. First, let me say collaboration with the private sector is critical. What we've seen in this last year of COVID-19 is that no single organization or sector can do it all alone. No single government can solve all of these problems. No company, no multilateral organization, no community organization. If we act alone, we will fail. And what we've seen in this last year is that when you work together and you allow governments to fulfill their role, and when you allow businesses to bring their competencies and assets and their engagement with individuals, businesses are how we engage the world. Each of us as a consumer, we're influenced by business and advertisement, by the materials that we receive from business, whether through social media or otherwise. When businesses can be part of the solution, we go much further. So engagement with the private sector, collaboration across the public and private sectors is critical. It's part of my job at the WHO Foundation. But we have to ensure that business doesn't have undue influence, particularly of an organization like the WHO that sets norms and standards. And so no single company will have a quid pro quo, as I've said, with the WHO. That's why the foundation exists. First of all, we will only accept contributions that are consistent with certain policies and principles of the World Health Organization. We won't take money from arms. We won't take money from tobacco. We also have a set of procedures, due diligence to company makes its resources, makes its money, and we won't accept contributions in the future from companies that violate World Health Organization policy. So if they're in violation of WHO policy, we will say we can't accept your contributions until there's compliance. Furthermore, we won't accept or we facilitate a single contribution from a business to a particular WHO program, and particularly ones in which there might be a perceived or real conflict of interest. The purpose of the foundation is to collect and aggregate those resources and then to give them to the WHO to pursue the intended work of the WHO without any particular obligation to a single donor or company. And that's the approach we're going to take. And of course, we're always open to feedback. We want to make sure that there are open lines of communication so that if there are perceived or real conflicts of interest that emerge, even despite those procedures, we can be immediately responsive to that.
All right, those are really imperative details that you shared with us, sir. But going forward, how will you simplify the process of philanthropic contributions in support of the WHO and make such contributions possible on all aspects of health and WHO's mission?
Well, one of the ways I think you simplify philanthropic contributions is you amplify ambition and you amplify impact. My hope is that the WHO Foundation can work with the World Health Organization to set incredibly ambitious approaches to some of the thematic areas that we need to tackle much more effectively in the future, whether it be the complications related to childbirth, antimicrobial resistance, the intersection of climate and health, the needs to build capacity for primary healthcare delivery. Each of these areas are ones where my hope is that we can set incredible goals that require hundreds of millions of dollars. And when you are doing something that's so big, then each of the philanthropic contribution plays a relatively small role, and we ensure that we are simplifying across them. So if you have a $100 million program, you can't have 100 $1 million donors, each of whom have their own reporting requirements. Then your organization is spending more time reporting than it is doing the work. So our goal is to work with the WHO to amplify its impact, to amplify its ambition, and in so doing, simplify the process that it has to go through to recruit and report to its philanthropic donors.
But so do you think that broadening WHO's donor base and working towards more sustainable and predictable funding, that is going to be the biggest challenge, especially in the post-pandemic era?
It's an existential challenge for the World Health Organization. And it's an organization, as I said, that was created 70 years ago that must evolve. The WHO's funding currently, only 20% of it comes from assessed contributions. In other words, contributions that are part of each organization participating in the United Nations. Those assessed contributions are supplemented by 80% of the budget of the WHO, which are voluntary contributions. That ratio is not sustainable because what that means is that the WHO has to take its hand out and ask for resources, contributions year after year for particular programs. And donors, even if we're talking about public donors now, not private donors, governments, they make choices about which programs make sense to them, which are of interest to them, which ones seem relevant in that moment. But sometimes the programs that don't seem relevant in a moment, pandemic preparedness seems very relevant now, but for many donors it didn't 2 years ago, those programs are then poorly funded. So the WHO, under the leadership of Dr. Tedros, is taking very seriously the need to establish more sustainable funding from its core member states. And that's a critically important conversation that's occurring with the member states as the stakeholders and shareholders of the World Health Organization. The foundation is here to help. Part of what we seek to do is to develop funding from other sources to, again, broaden out the donor base, make sure that the WHO is benefiting from more flexible funding whenever possible, but that doesn't solve the underlying problem. So what you've said, Kriti, is exactly right. In order for the WHO to be successful in the future, it needs more sustainable and predictable funding, both from new sources, but most importantly, from the existing member states.
All right, Mr. Soni, at the risk of sounding repetitive, as we said that this is an uncharted territory. We don't know how the virus is going to behave, whether we'll have the 4th, 5th, 6th wave or the subsequent waves. In this scenario, how do you assess the global preparedness?
Well, in terms of global preparedness, I think the world has never seen, or at least not since the Spanish flu 100 years ago, anything like this coronavirus. And so did we act well at the beginning? Yes. Were we as prepared as we need to be for the next pandemic? No. And it would be a crime if we don't learn lessons from the last 2 years to ensure that in the future, we can be more prepared for future pandemics. So while I want to give credit to all of the government's community organizations and individuals, really individuals, people who had to adapt their lifestyles overnight, change how they went to work, find ways to ensure that they could take care of their families if they were out of work, learn how to become soldiers in a public health fight by doing simple actions like washing your hands and keeping distance. All of that engagement has prevented more death, but the consequences of COVID-19, both in terms of lives lost, affected, the economic impact, are incredible. Really, I don't think I've seen anything like it in my 45 years. And so it behooves all of us to ask ourselves how we can be better prepared next time. And I really want to give tribute to those organizations, including but not limited to the WHO, who are already asking that question and commissioning reports to do the hard work of looking at what went well, go better, so that we're learning lessons as we go, not waiting until the end of the pandemic when it feels a lot more comfortable to ask those questions, but even in the middle of this pandemic in our current fight, asking those questions so we can learn as we go.
So we can learn as we go. And what is your assessment of the global vaccination drive, sir?
Well, first, I think it's important for all of us to take a step back and recognize that the creation of multiple vaccines and their availability to tens of millions of people within roughly a year from the beginning of the pandemic is breathtaking. Nothing like that has ever been achieved before. And it's been achieved thanks to creativity and boldness on the part of both the private sector, the companies that helped develop these vaccines, but also the public sector, the governments that helped fund that development, the researchers who came together to pool their data and their resources, and the philanthropic organizations who also contributed. All of that work and the multilateral organizations who created COVAX, the initiative of those organizations focused on vaccines, including the World Health Organization and Gavi, that has made possible the distribution of vaccines to tens of millions of people. The challenge, and this cannot be overstated, is vaccine inequity. The fact that there are those in the world who are privileged and thanks to their governments or their own resources have access to vaccines and honestly are returning to something that resembles normal because the vaccination levels in some of these countries are so high, 70, 80%. And then the rest of the world, which is being left behind. And there aren't enough vaccines for the individuals in these other countries, and they face a very different reality. So we have this bifurcation of parts of the world that are feeling hope and relief, and parts of the world that are continuing to feel fear and anxiety because they don't have access to those vaccines. That's morally not justifiable. It's also epidemiologically self-defeating because the pandemic won't be over anywhere until it's over everywhere. And the reason is because as long as the virus is spreading, there is a risk of vaccine resistant variants, and also it affects the global economy. So morally, no, and economically and epidemiologically, it also doesn't make sense. And yet that's the reality we're facing. So there is an imperative on all of us, both governments and individuals alike, to do our part to make sure that we're contributing to vaccine equity, to make sure that we're contributing to every single woman, man, and child having access to the same opportunity to feel the freedom of being protected from this virus. I'm glad that the G7, when they met recently, prioritized vaccine equity and made commitments for 1 billion more doses, but we need more than 1 billion because there's more than that on the planet. And we also need to actually manufacture and effectively distribute those vaccines. I'm also very proud that we've created an initiative called Go Give One at gogiveone.org, where individuals who have resources to give $5 can do so and know that that's going to buy another vaccine for that COVAX initiative, which will deliver those vaccines as soon as they're manufactured and available. So there's an opportunity for individuals to pitch in, and that often helps governments know how important this is, so they do ever more to make sure that we can achieve vaccine equity and solve this state of the world today where some have access, but too many don't.
Absolutely, completely corroborate your stance on that. But before we sign off, Mr. Soni, your closing remarks on WHO's 5-year strategic plan to protect 1 billion people from health emergencies, extend universal health coverage to 1 billion people, and assure healthy lives and well-being to 1 billion people by 2023.
Well, Kriti, I'm so proud and happy to hear that you know what the triple billions are. And for your audience, I want to repeat that simply to share that the ambition of the World Health Organization is to deliver on the right to health to everyone, everywhere, because health enables everything else in our lives. And we've seen very much this last year in COVID-19. The World Health Organization, as I said, can't do it alone. It requires collaboration with national governments, with community organizations. It exists in part to work with the system to provide the resources, the national guidelines, the tools, the assessment of the efficacy and safety of different medicines and vaccines and diagnostics. All of that work enables local success and enables those ambitious goals of reaching those 3 billion additional people with protection and health services. And that is an incredibly leveraged way to affect the system. People often talk about the WHO as if it's a large organization, but it has the budget of a single hospital in New York. Its annual budget is that small, and it's trying to influence and affect $8 trillion of global healthcare spending across every country on the planet. So the WHO has a huge set of shoes to fill in terms of the necessary role to extend universal healthcare, make sure that the access is translating to outcomes, and prevent people from being affected by health emergencies in the future. My job and the job of many people at the WHO, including its visionary leader, Dr. Tedros, is to ensure that the WHO is effective at pursuing those goals, that it's innovating, that it's evolving. It's 70 years old. And when you get to that age, it's important to keep on learning, to keep on adapting, because the world's changed around you. And I'm glad to say that the leadership of the WHO acknowledges that and isn't just setting bold vision, but is ensuring effective strategy to achieve that for the benefit of all on the planet.
All right, on that note, Mr. Soni, you joined us, you shared all those important details with us. We understand that you have an uphill task given the pandemic situation, but all the very best for your endeavors, and thank you so much for speaking to us, sir.
Preeti, thank you so much for the program.
Thank you so much for joining us.